Good afternoon, everyone, and welcome to Shenandoah High School. Uh, With the new contract agreement, changes in health insurance, obviously changes in salary for certified teaching staff, we are thrilled about both, obviously. Uh, Josh Estel is here today from McGowan. He will lead you through and answer questions on new health insurance. Shenandoah, for the first time in 20-plus years, as of November 1, will no longer be self-funded. Self-funding served very, very well for many, many years, but it's just time with the economy. It's time for a change. Money can only be spent in one area. We were spending money on health insurance that really a company needs to spend. The premiums will be paid, deductibles will be met, and then the obligation becomes a private company's obligation and not Shenandoah's. And then that way we can hopefully continue to spend that rest of that money for teacher salaries and salaries of other hardworking staff in addition to teachers in the school corporation. So Josh will give you some information. Understand, I know there'll be questions. Lana will send out more information tomorrow via email. So you have it not only today, but also tomorrow and ready access to it via email, okay? Thank you all for all you do for children.
Yep, thanks, Ron. Yeah, Ron's right. Just to give everyone a little bit of background, we took the information from Unified, all your data, a lot more data than you can imagine, and when there was discussion about going to the state plan or looking at alternatives for self-funding, we actually took that data and we went to every single insurer in the marketplace, both fully insured and self-funded, and got proposals from everyone. So, Cigna, Anthem, United Healthcare, everybody in the market. United Healthcare came back with a very attractive proposal, and we had a few meetings with your leadership, both the school and some of the teachers, and tried to narrow down plan offerings and get something that was a really good plan, but also was cost effective. One of the kind of unique challenges that we had specifically to the HRA plan is those HRA plans are somewhat archaic now, and most carriers don't offer them. So we had to look at alternatives that we thought made the most sense for the school and for the staff. So on this page here, everybody should have 4 different handouts. On the page that has the 2 plans, you'll see when you get the formal summary of benefits, it's 12 pages long. So in order to, you'll get that electronically, but in order to save trees, we tried to summarize some high-level information here on 1 page. So what you'll see here are 2 options. On the left is the Navy plan. That basically is identical to your current HSA plan. So for those of you that are on the HSA currently, this plan is going to match up almost exactly from a deductible out of pocket, the way that works. The right-hand plan is also an HSA, but with a lower deductible. So it is going to mirror more on the deductible side what that HRA had. The big difference is in any HSA plan, the federal government says that preventative care is the only thing that can be paid first dollar by the insurance carrier. Everything else has to go to the deductible. So those of you that are on the HRA right now, probably the main difference here is you're going to pay the cost of your drugs and office visits until you hit the deductible, where right now you have a copay on those. But you'll see at the bottom, the school corporation is going to fund everyone's health savings account. So you will have a health savings account that the corporation will put money into so that you can use to pay for those day-to-day expenses until you hit the deductible. Especially if you're looking at that gold plan, the school is funding a pretty significant percentage of that deductible up front. So I think that's for those of you that are on that plan, you'll have that money that the school puts in, and then also you'll be able to contribute on a pre-tax basis into the health savings account. So I don't know, Lana, if you guys have decided what bank you're gonna,
I think we're going with Star.
okay.
If they have online enrollment, so you can just go online and open up your HSA, you don't even have to go in or anything. But we're gonna try to all have one bank, so that we can contribute employer money, things like that, so.
Yeah, so they'll put money in the health savings account, then you'll be able to put money in either by payroll deduction, or you can put it in directly on your own, and you'll get that tax savings at the end of the year, by putting the money in the health savings account. And then you can use that money to spend not only on your deductible and co-pays, but dental, vision, over-the-counter drugs. I mean, it's very flexible, what you can use, that account to spend money on from a health perspective. Both of these plans, as I mentioned, are with United Healthcare, so it is going to be the United Healthcare network. So, last year, you kind of took a step back and had narrower choice of providers. Now we're going back to the largest single network in the United States. So roughly 95% of providers in the country are in the United Healthcare network. So you kind of have to work hard to get out a network. For that reason, there is some cost savings to have no benefits out of network. And because of the broad scope of that and the fact that essentially on the out of network plans, the deductible is double the in-network. So you would have to hit 12,000 or 6,000 with an out-of-network provider before it paid anything. And we save about 5% by eliminating those out-of-network benefits. So just make sure you're going in the network. If you're traveling or you have an emergency, or occasionally we run into situations where there may not be a specialist for a particular thing that's in the network within, say, 30 miles, there is a process to go through to get an approval if you needed to see someone who wasn't in the network because there was no other option available, or in an emergency situation, those things are going to be paid as in-network. So most of our clients for the last 5 or 6 years that have had Anthem or United Healthcare have gone to not buying out of network benefits because they're just so rare that you're going to run into that. So just note that, though, the network is extremely broad. It's going to bring back now in like IU and Community and some of those that went away last year. So on each of these plans, after you hit the deductible, at the bottom you'll see the co-pays. So ER, drugs, and office visits will have co-pays after the deductibles hit, and then everything else will be paid 100% on both plans. I'll stop there, see if anybody has questions specific to the plan designs or United Healthcare Network or anything else before I get into just a few other features of these plans.
What about those children that are still under 26 that might still be on plan?
Same rules, yeah. That's a federal law. So if your child is under 26, they're eligible to be on the plan.
So that out of network, because once in a while they're in an area where.
If you have a child away at college, that's going to be that situation that I still don't think you'll have an issue. I mean, I think there's going to be a ton of network choice, but if we do run into that issue, just reach out to us and we'll help you work through that.
If we already have the HSA through STAR, do we need to re-enroll when this takes effect, or?
No, if you already have one through Star, you're fine.
Okay.
Yeah.
You have it through somebody else, will you just?
Couple other things real quick, just so I may answer your questions. All these changes are November 1st, so keep using your UGS card until November 1st. And then we will get a report from UGS, and any deductible that you've met on your plan currently will be credited on these plans, and then that'll start over again in January, just like it normally does.
What do we do if we have section is it 125
Yeah, flex
money
spending
now?
account.
Like, how do we make that work?
So what you need to do is, you can only have what's called a limited flex if you have an HSA, which is dental and vision only. So, you'll wanna spend your money down before you open the HSA. I thought it was less of an issue because of the time of year we're doing this, because a lot of you probably have most of your flex money gone or can't get it spent, hopefully. If not, you will just wanna wait until you spend all your flex money to open the health savings account. Or we can talk about this, we can convert that to a limited flex now, and then the downside of that is gonna be though, that then you can only use that for dental and vision
Yeah, I can
expenses
convert it,
at conversion. So I'm guessing most of you would probably, because we're gonna have another month here of UGS bills, probably will wanna keep the flex in place and spend the money as much as you can. You can, for the flex, buy over-the-counter prescriptions or over-the-counter medications, that type of thing. So if you just have a little bit left and you need to get ibuprofen or cough syrup for your child or something like that, you can use flex money for those kind of things too. That might be an option. Otherwise, I would just suggest that you wait until later in the year, till you've spent the flex money down, to open the HSA and then get your deposit.
So when it takes me until May, because it will take me until May 1st to spend my flex money down, I have to wait until May to do this? I don't understand this at all, so.
Technically, you're not supposed to have a flex open at the same time as you have the HSA, so that might be something that we just want to talk about individually on a one-off basis. Yeah.
So is the HSA money that's coming from the school, is that gonna be put in like right away, or is it incremental like it is now for HSA?
Yeah, cause right now we just pay it per month.
Yeah.
Which we talked about still doing that. We're still kind of in discussions because everybody's going to one. We talked about doing like half now and then half 6 months through the year to get something in there. But, that's still kind of up for discussion. I'll know by tomorrow.
Okay, no, that's fine, thank you.
Okay.
I'm sorry to belabor the flex spending issue, I'm just trying to wrap my mind around, because they take, let's say, $100 out of your account every check through May, you get the $2,700 up front. So if I stop my flex spending, do I stop contributing that 100 pre-tax flex spending, and then what, like, how does that work? So
The flex account can basically be spent on the same things as the health savings account. So if you've got flex money, then I would probably just let it run its course and not elect at the open enrollment the flex and convert that to the HSA and open the HSA at that time.
it doesn't sound like we can do anything else, I mean, we have to pay out.
Yeah, I mean,
Unless we
you
stop
have,
collecting.
you have to keep contributing to that, flex
Yeah.
spending account.
Yes.
I mean, that's deducted
So
per
May
day,
1st, okay.
even if
Yeah.
you spend it all, so.
Yeah.
Okay.
But essentially, I mean, the only difference between the HSA and the flex is the HSA money rolls over, so you don't have to use it or lose it, and it's normally an interest-bearing account at the bank, and it's your money, not the employer's. So you're not really, I mean, the advantage of the HSA is that they're gonna put money in it and that it rolls over. You're really not gaining like, additional items that can be paid through the HSA, because that's basically the same as the flex. So I would just spend the flex money down and then open the HSA.
So you'll give us, even though there's no enrollment period, we'll have grace until May to set up the HSA and still receive the contribution?
I would assume that's,
So you mean to go retroactive and give you all the,
Well, I'm just saying, you're telling, there's an open enrollment period, will that close before May? And if so, those of us
gonna be the only challenge is, any money put in 2021 would not be able to be they would not be able to go back and match that for 2022. So my answer would be, you would get all the 2022 contributions, that the school puts in, they just won't be able to go back and put anything in. If you don't have the account established till 2022, they're not gonna be able to go back and put 2021 money in. So,
Right, because the federal government's looking at the pre-tax status of it, and there's a limit. So, and what we contribute is part of that limit, in addition to what you contribute, if you contribute anything over the premium. So that's what we're trying to avoid with the flex spending account, is getting too much pre-tax money to where it throws up a flag to the IRS.
Would it be safe to assume then, if we set up our HSA at May 1, that would be prorated down from the 2,000 to whatever the contribution would be to the end of the year?
That it would do what, I'm
So if
sorry?
you're contributing $2,000 in health savings, but you don't set it up till May 1, will we still get the full 2,000 contribution, or will that be prorated?
Oh, you mean for 2022 or
Yes.
whatever?
Yeah.
No, I mean, I think once we hit 2022, as long as you're not waiting until like October of 2022. But yeah, if you, are finishing up your flex spending account money, I think we can do the full amount for 2022, absolutely.
So since my husband has to have different insurance than I do, he already has a health savings account. So, and I don't think it's through Star Financial. So am I still, and you can only put so much money into that account, right?
yeah,
So if I have one too, what's that going?
you can have two, so you would just each be limited to the single contribution, which is, it's half of what the family is. So, I mean, I would say your options would be, if his employer doesn't,
But I have family. I mean, I have my kids online,
oh yeah, so then you could do the family,
and he would have to go to being single.
yeah, yeah, yeah.
Okay, I've done the HSA before, so it sounds like that's the only option, right?
Yeah, they're both HSA.
Okay, so I've done when I open this account, and I carry family right now, is that $2,000 you put in for family? Okay.
Per year.
Per year, and then that goes towards the deductible of family, which in the gold plan, it's 6,000.
Yeah.
Am I getting that right?
Yeah, I mean, if you wanted to get, I mean, it's a matter of semantics, but it will be used toward all your out-of-pocket costs, but it's at your discretion. So some people might argue that the going towards language is confusing because it's not going to automatically reduce your deductible. If you wanted to pay deductible expenses out of your pocket, which I don't know why you'd ever want to do that, you could. So you're still gonna go and get a bill from the provider, then you're gonna get a debit card from Star, and then you'll be able to pay expenses, dental, vision, anything you want to out of that, and then contribute additional money. Now, I would always, even if you don't wanna fund anything above the 2,000 right away, any bill that you pay to a provider, you could just go deposit money from your checking account into that health savings account and turn around and pay the provider, and you're gonna get that pre-tax. At the end of the year, you'll get a statement from the bank to take off your taxes. So I would just tell you, even if you don't wanna payroll deduct HSA dollars, because let's say you don't have any prescriptions, you don't anticipate having anything, but then something comes up and you've gotta get a surgery, you wanna run that money through the health savings account so you can get the tax deduction on it at the end of the year.
And what's the cap on contribution for how much can it?
Family's like 31.
It's more than double, it's like 7,350 for family,
Oh, for family.
for a year, yeah. So like if you have family, it's like 3,800, I've got an FAQ on HSAs. It's a weird, like, it's indexed for inflation every year, so, like, for 2022, it's like 3,950 and 7,850 or something, but the bank will know, it's over 3,000 single and over 7,500 for family. that you can put in combination between what the school puts in and then what you put in. So it's a combination of the two.
And just a side note too, which I'll send this out tomorrow as well, the premium is going down enough that you could probably take some of what you were paying in premium and put it towards your HSA because it's, at least in half.
In HSA, so it works. It's a combination of like a checking account and an IRA. So you can use it like a checking account for qualified medical expenses, but then if you roll that money over, when you get to 59 and a half, you can take it out for any reason. So it basically follows the same rules as an IRA or retirement plan. So once you hit 59 and a half, then you can take the money out for any reason. It's your money.
I missed what you just said. Again.
Yeah, so once you put the money in the HSA, you can only spend it on qualified medical expenses today, but when you hit 59 and a half, then you can withdraw the money for any reason. It basically becomes like a retirement. It's got the same rules as like an IRA or a 401k. So then you take it out between 59 and a half and 70 and a half. You can also use it to pay Medicare supplement premiums, and you can use the money in there forever to pay qualified medical expenses. So let's say you're employed with Shenandoah for the next 5 years, and you have $10,000 in your health savings account built up. You leave and go to another employer or retire, even though you don't have a high deductible health plan where you can contribute to the HSA any longer, and you can't do it if you're on Medicare either, but you can use the money still to pay for expenses or anything while you're under 59 and a half. Once you're 59 and a half, you take it out for any reason.
So it's 7,000 and something a year that we can put in.
Yes.
And that can keep building.
Yes.
Can keep building.
It's your money, so the money that they put in and you put in, if you leave employment or any, it's your
Our
money.
It's not like we have to wait until we're vested.
That is the main difference between the HSA and the flex, is that it rolls over, not use it or lose it, and it's your money. So, not that anyone would do this, but literally the minute that the school puts the money in, if you left employment tomorrow, that's your money. Once it goes in there, it's yours.
Is there gonna be any, we have a single and a family plan, is there going to be anything for a 1+1, where it might just be a husband and spouse?
That would be up to the corporation. We matched the 2-tier rates. I personally think that the 4-tier rates are more equitable to some degree, but that would be United Healthcare.
Probably will when we have more time.
Yeah,
This is
Yeah.
really rushed.
Yeah,
Matter of
so-
fact, open enrollment is 4 days.
yeah. So that's a good point. Real quick. So open enrollment is this week. In order for us to get ID cards to you timely, really, really important that you complete your elections this week so that Lana can get us the census with what you want coverage-wise, which plan you want, who you want on there. Because it takes about 14 days, give or take, to get ID cards printed and out to you. And so those of you who are going to need to use that on November 1st are going to want ID cards. And to do that, we need to hit this week's deadline at all possible.
So when is the tutorial on what this means when you're speaking Chinese? Because I have no idea what any of this means, and I don't know how I'm gonna make an informed consent in 4 days until somebody can sit down with me personally and explain this with pictures and numbers and charts.
I think,
And I'm not kidding, I'm not even exaggerating, I have no idea what any of this means.
so I think, once Lana sends out the rates, that will also help where you can see what your cost will be on the 2 plans.
Hey, Lana, we'll make an appointment, you can explain this to me when you're not trying to do 9 million other things.
Okay, depending on how fast you want that salary increase.
Okay.
I mean, this seems oversimplified, but on both of these plans, other than preventative care, you're gonna pay the cost of care until you hit the deductible. So if you pick the gold plan, when you get your Pap mammograms, annual checkups, United Healthcare is gonna pay 100% of it. Everything else, you're gonna pay the actual cost of services until you hit the 3,000. So if you go to the doctor, your doctor bills $70 for the visit, you're gonna pay, presumably with your health savings account, the $70 until you've hit the deductible. You go fill the prescription at the pharmacy and it's $20, you're gonna pay the cost until you've hit the deductible.
I just don't wanna waste everybody else's time, cause I don't understand this. Let everybody else get on with their life, and I'll figure it out later.
Okay.
My question
Figure it
is
out.
simple. What is what dental insurance are we using and what vision?
So you got my next note on my list. So the dental and vision are not changing. So those are staying with the carrier that they're with. So they're staying with Delta and VSP.
Yeah, just not through.
Yeah. Yeah, so this is the medical only. So those are gonna stay separate just like they are now. Anything else on plan design, network? Okay, well, we can come back to that. I wanna hit a couple things here. You have a sheet like this that has the $49. Just wanna make everyone aware. I think everyone's probably a lot more familiar with this than they were pre-COVID. But, United Healthcare does have a $49 teledoc option, on all their plans. So, you know, in lieu of you paying a $1,500 ER bill on the weekend, they do have a 24/7 teledoc. Obviously, you have urgent care and some of those options as well. We have United Healthcare at our office, and I've used this teledoc for things like sinus infections. It's really convenient if you have something minor like that. So I just wanted to remind everyone of that. The 2-page flyer here, that has a picture of the lady on the beach. United Healthcare does have a fitness reimbursement program. It is $20 a month per person. So, like, if you have a family of 4 on the plan, you actually could all get, in theory, $20 a month at one of these participating fitness centers. But you can see, like, why most of the nationals, you know, the Anytime and YMCA's and those are on here. The How Do I Enroll, we'll walk you through it on the website, but you just have to check in 12 times at that facility that month, and you get $20 reimbursement towards the gym membership.
So how do you find out if yours is on there?
It's on there.
Send it.
No, like,
It's right there.
no, I know, but like mine's, oh, okay.
All those are the franchises. They're all, if that franchise participates, they all
Well, it's
participate.
not brand, it's a White River Fitness out of Anderson.
You might ask them and go to the YMCA or go to the UHC website too. They'll have all the fitness centers listed on their website. And then lastly, this 2-page plan that has the 1,095 over to the left. So United Healthcare has a program called Motion, and they actually just literally, I got the email. You know what it is. They just expanded this program in the last week or so to encompass some broader exercise like swimming and some other things. But if you look on the back, the original program, you can earn $3 a day into your health savings account just by steps or swimming or other exercise. So basically $1,100 a year of United Healthcare money in addition to what the school puts in just for exercising. It connects, like I've got an Apple Watch, and you just download the Motion app, and that's each person as well, each adult. So, like if you have 2 adults, you can get $2,000 into your HSA from United Healthcare by getting steps, Fitbits, Apple Watches, anything. You just get the app on your phone, and then possibly on your watch, and they talk to each other. So.
So I have a family plan and I have, my 4 kids are adults, but they're still under 26, do they count?
Yes, they do. I think there might be a cap of like 4 per family. I can find that out and let you know, but it definitely the adults, are eligible.
Didn't you say if you don't have a Fitbit or anything like that, that they'll give you one?
They give you they will give you a $70 allowance, to get like a base Fitbit if you don't have one. And if you have one already, you get that $70 in your HSA to start. So, yeah.
So is there
Is that included in as well?
Anything that'll connect to their app, so like Apple Watch, Fitbit, any of those. My wife got over $1,000 this year in our account for steps. So, they really do deposit it once a month into your HSA.
And it says now, like, $70 a day.
Yeah, yeah. In all those programs, if you go to the UHC website and go under that motion, on the second page, it shows you the link, UnitedHealthCareMotion.com. You can see more of the information on like the swimming and biking and some of the other things that they've expanded to here recently.
And we can't do these until November 1st.
Right, correct.
Once November 1st hits, we can sign up.
Everything is, you'll have to have your ID card to put in there, your member ID. Also, when you go out to the United Healthcare website, they have a diabetes program where you can get free and reduced supplies. They've got all kinds of other wellness things out there, disease management type of things that you guys might want to specifically tailor to you. I tried to hit the 2 or 3 things that I think are more popular amongst people, like they give you money. That's normally a pretty popular thing. So try to make sure you don't miss out on money in the HSA or fitness reimbursement. But they also have other programs that might help you in your specific situation as well. And all those are free.
I have one more question. Last time, or with our last insurance, they took away, the insurance wouldn't cover any injectables, is that what they're called?
Yeah, the specialty meds,
Specialties med.
those are going back in.
Okay.
Yep. And, I mean, not that what we were doing before, we don't believe in, but on some of these fully insured products, they have contractual obligations and contracts with pharmacies of what's covered and not covered, and those are not negotiable. They're just what they are across the board. So those are back in and covered like normal. You will have to hit your deductible on those before, and then there'll be a copay. So
And then there will be a copay after you hit your deductible?
yes, on the drugs. So the drugs and office visits, and then it'll be up to that annual out-of-pocket max. So really, like hospital, lab, inpatient, everything, once you hit the deductible, it's gonna be covered 100%. And then drugs and office visits and ER and urgent care will have those co-pays listed. And then once you hit the out-of-pocket max, which like on the gold plan is $6,200, then everything's covered 100%.
Can you go through this line by line and explain it?
Yep.
I don't know what any of it means.
Okay, so I'll tell you the plans both work essentially the same way in that you have to hit the deductible first for everything but preventative. So on the Navy plan, if you're on a single, you're gonna pay the first $6,550 of non-preventative expenses. That's everything. So anything that's not preventative, you're gonna pay that. On the Navy plan, once you've hit the 6550, then as you go down and you see 0%, that means everything's covered 100% for those items. If there's a copay where it says copay listed after deductible, then you're gonna pay the copay until you hit that $68.50 out of pocket at the top. So you could pay another $300 in copays, and then United Healthcare would pay 100% of everything thereafter. On the gold plan, everything I just said is the same, except you'll see PCP is primary care physician, so you have a $30 copay there after the deductibles hit, specialist, 60, ER, urgent care, and then drug copays. So you'll pay those copays after you hit the deductible until you've hit the out-of-pocket of the $62.50, and then everything will be covered 100% on the gold plan. So those of you on the HSA now, basically it works identically. If you're on the HRA, the major difference is you're gonna fund the cost of the drugs and office visits up front until you hit the deductible instead of having a copay. But you're gonna take the HSA money that the school gives you to pay for those items.
Josh, do you want to explain about the embedded thing?
Yes, so, and you'll see up there the word embedded on both of these, that's a good thing. So that means that you have both a single and a family deductible, even if you have family coverage. So on some HSAs that are called non-embedded, if you elect family coverage, you just have the family deductible for everyone in aggregate. So on each of these, like if you pick the gold plan, even if you have family coverage, each person has a $3,000 deductible as well. But then once the family hits 6 in aggregate, then it would be covered 100%. So it could be either or. So if just one person had a lot of bills, it's just $3,000. So you don't have the family deductible for each individual person. So we've got an individual and a combined family.
Do we need to healthcare blue and look at where we should go for blood work and all of that?
So UHC on their website has a similar service where you can look at cost by facility and charges, and it's their pricing. So you'll be able to use that once you get your ID cards. It works basically the same way as the healthcare blue book.
So realistically, for a family plan, we could end up paying $12,500 in deductible.
In out of pocket. So
Where before, our max was gonna be the 6,000 or whatever.
yeah, I mean, most plans, most HSA plans out there, even on the self-funded side, have copays on drugs and office visits after the deductible. I would say that it would be a really, really unique situation for someone to get to the 12,500 because you'd have to accumulate that in $5 or $50 copays on drugs, and I mean, I guess you could be on 10 or 12 drugs that have $100 copays, and maybe that would be possible. But I think for the most part, a lot of people probably won't get much above that calendar year deductible, depending on their situation.
So whatever program, like my husband, he's on Humira, and I know that it's like insanely expensive. But he gets it covered right now because of the whatever program
Yeah.
they do.
I would try to keep doing the RX Health Centers. They typically just do annual checks on those things. So he might be able to continue it, and he might be able to keep it for a long time. Typically, like RX Health Centers also, even if you have coverage on a copay plan, like a lot of those kind of drugs have copay assistance where like RX Health Centers, if they can't get it for free, they can get your copay covered or get 50% of it covered. I would just have the conversation with RX Health Centers about that, yeah. And I would highly, highly recommend that if you don't have GoodRx, like GoodRx app or something similar on your phone, to download that. I mean, you would be amazed at, like, I bounce the one prescription we have in our house, I bounce it to different pharmacies every month, and it'll go like $40 to $140 at this pharmacy, and then the other pharmacy will be, $30 that month based on rebates and things they have going. So, there are ways out there for you to reduce your costs, like through other programs like that. It's free. You just download the GoodRx app, put your zip code in, put the drug in. It's going to list every pharmacy and what the cost is that day for that drug.
Value Health and St. Vincent in your network.
Yep.
Go back to our old providers.
Yep.
You got names.
Yep. Pretty much every major system in the country is in the United Healthcare and Anthem network, so, you shouldn't have much trouble.
Lonnie, you'll be sending out more information as far as the cost and training.
Yep. Yep, in the morning.
Anything else? I'll hang around for a few minutes if anybody has individual questions and, that you don't ask in a group setting, I'd be happy to answer that.